Managing your healthcare costs, deciding where to go in an emergency can really make a big difference. Today, Local 10 medical specialist Dr. Soffer takes a closer look at how you could save a bundle if you know when to choose an urgent care center and when to go to the ER.
You won't get a ride in the ambulance, but you also won't get the bill. That could equal thousands of dollars. Emergency rooms have their place, but more often than not, the place is unnecessarily used.
We're running into a problem with overutilization of the emergency room for things that are non-emergency.
According to the CDC, nearly 130 million people visited ERs last year, and only 13% were admitted into the hospital.
Most of the things we can do without going to that extra time and expense.
Rodney Heath is a perfect case in point.
I got a little too sloppy with my chainsaw and sustained a fairly large laceration.
Instead of heading to the ER, Heath came to Dr. Behringer.
I think he put about 15 stitches on the inside and about 30 on the outside, and we were good to go.
And the cost?
We are probably on average less than a fifth of what the charge is for the same thing at the ER.
Most urgent care centers can do x-rays, stabilize an injury or wound, and help you get an appointment with a specialist. More serious or life-threatening issues require a visit to the emergency room.
In the emergency room, we use a triage system, which means that people who are the sickest get taken care of first. They get first priority.
Because you can't plan emergencies, it's important to plan ahead. Urgent care centers vary in pricing and expertise. Familiarize yourself with what various centers have to offer so you know where you need to go if you need help. For many people, urgent care centers are all about location, so call the ones nearby and see what they're capable of doing. And don't be afraid to ask for prices. Also, don't forget to have your records sent to your family physician. Your regular primary doctor will need to know how you were treated in order to best care for you in the future. With your second opinion, I'm Dr. Soffer.
And one more note here, Florida law requires urgent care centers to post their pricing information. So if you don't have insurance, you know exactly what you're going to have to pay for in those services costs. And emergency rooms don't actually post that information because they are required to treat everyone, regardless of your ability to pay.